everyone. Welcome. If you would, please have a seat. We're going to get started. Thank you all for your patience and cooperation as we adjusted the start time for the session. And again, welcome. This is the introduction of the US CDC's Global Digital Health Strategy. So we're very pleased to be here today to share about this important document and what it means not only for the CDC, but for the entire global health community. My name is Brooke Partridge. I am the CEO of VitalWave and your moderator today. For those of you who don't know us, VitalWave is a professional services company. We specialize in digital for development, particularly in digital health. And it was our pleasure to work with the CDC in shepherding the development of their global digital health strategy that we're here to talk about today. And one of the very unique aspects of this document is that it articulates a strategy not just for the CDC, but for the entire global health community, and identifies the role that the CDC will play within that. And indeed, the composition of today's panel will illustrate how the global health community is already circled around this strategy, which focuses on the use of shared platforms and an enterprise architecture approach to country and region-led digital health. So with that, let me introduce our panelists today. We have Zen Santas from the US CDC. Zen is the Associate Director for Informatics and Information Resources at the Center for Global Health. And Zen led the creation of the CDC's Global Digital Health Strategy that we'll be talking about today. Daniel Morenzi from the East African community is with us. He is the Principal Information Technology Officer for the EAC. He leads ICT for the East African community and the 7 partner states that are members. Garrett Mell of the World Health Organization is with us. He is the unit head of digital health technology in the Digital Health and Innovation Department for the WHO. And finally, Merrick Schaefer, sorry, I've gone out of order. Merrick, of the US Agency for International Development. He is the Senior Health Advisor at USAID's Center for Innovation and Impact in the Global Health Bureau. In terms of our process today, Zen will open the session with an overview of the CDC's new strategy for digital health and talk about how funds are already being programmed towards its implementation. Afterwards, each of the panelists will spend 5 to 10 minutes speaking about how this strategy is already playing out in their own organizations, how their own organizational strategies match up with what the CDC is putting forward. And we'll use the remaining time for Q&A, including time for audience questions. So with that, I will hand it over to Zen.
Thank you, Brooke. Thanks, everyone, for your time and attention today. I am going to put this here, otherwise, who knows what will happen. So, I'm actually going to talk about 3 things today. I want to talk about the Global Digital Health Strategy in the context of what's happening elsewhere in the agency, and in particular, what's been able to happen because of, COVID changed everything. One of the things that it did is highlighted some challenges with data systems, with digital systems that I think were long-standing, but as a result of that highlight, the U.S. Congress has allocated a large number of additional resources to help us address that, which we're taking advantage of domestically in the U.S., and then also hope to take advantage of that in our global work. So a rough overview, I'm going to talk about 3 things. The Global Digital Health Strategy in the context of the domestic work, the CDC Data Modernization Initiative, and then what I am calling the Global Public Health Data Innovation, which is a extension and adaptation of the domestic work to implement and assist in the global community. So I'm going to start a little bit out of order. I want to talk a little bit about the overview of the global public health data innovation. At the top level, the purpose of the GPHDI is to provide government decision makers with more timely, accurate, and comprehensive public health data to better prevent, detect, and respond to public health threats. It was authorized in 2021 under the America Rescue Plan, which allocated approximately $140 million to this effort over 3 years. We are currently at the beginning of year 2, so this is underway. And it's addressing longstanding issues, limitations to data access, to data quality and use, lack of adoption of standards, workforce limitations, and then gaps in governance and policy that inhibit the development and implementation of digital solutions. Foundational to the GPHDI is the Data Modernization Initiative, which is a domestic effort which got $500 million allocated to it in 2020 and is helping to transform both the infrastructure that CDC uses for its own operations, as well as what's happening in state and local health jurisdictions across the country, and within the larger context of the health field within the U.S. And leveraging that, adapting it towards application in the global space. And then I will also just summarize a bit what's in the strategy. So GPHDI has 5 specific goals and objectives. One, the overarching aim is to strengthen global outbreak response, pandemic preparedness, and routine surveillance through improving the underlying data infrastructure to improve data availability and use by looking at systems and processes at all levels. The overarching goals to improve data linkage. How do we gather data from across an enterprise? How do we bring it together? What are the tools, what are the processes needed to accurately match and deduplicate records? How do we put all of that together? How do we catalog it? What is the computing infrastructure that's needed to do analysis of the data? Whether we're talking about a trickle of cases pre-COVID to millions, hundreds of millions of records, some of them quite voluminous, like genetic sequencing data, requires a lot of computing power. How do we set up infrastructure that actually is able to scale and is robust and affordable? The next focus is an area of data automation. How do we bring together data electronically from various sources, from laboratories, from clinical records, from other data sources like environmental health? What are the message content that's necessary to do that? How do we standardize it? How do we pull information in an automated way so that we reduce the burden and also the data quality issues associated with manual entry? How do we integrate that information? How do we use that data better to improve situational awareness? How do we build capacity of the workforce to better understand the data, both at the worker bee level? What are the analytic tools that people need in order to do the work, but also at the leadership level? What does leadership need to better understand how to understand technology, how to design it, how to buy it, who to work with in order to make efficient use of resources? And then finally, and importantly, what is the international cooperation needed to do this in a coordinated way so that we're working together, we're complementing each other's efforts, and we're sharing the outcome of that progress so that it can be adopted more fully. So a little bit about backing up the CDC Data Modernization Initiative. Some of this I'll go through a little bit faster because I think that there's quite a bit of synergy between the different initiatives. Data modernization is at the heart of a national effort to create modern, integrated, and real-time public health data, or near real-time public health data, and surveillance that can protect the population from any health threat. It is intended to solve a number of problems that I think are well known. Siloed information systems. I mean, historically, what CDC has done, what others have done, is every time you have a new data collection need, you build a different system. You set up SQL servers, you hire the data managers and the security staff to do the patching. Really, each program, each system at a time. How do we move from that paradigm to we consolidate infrastructure so that the hard part, which I think is often the infrastructure part, is actually done in a consolidated way so that it's available anytime we need new data collection activities. How do we bring the workforce up to date? How do we reduce the burden of public health reporting on providers? In other words, how do we use automation to pull data in an authorized way with appropriate protections? And then the policy level improvements that are needed to share data more effectively, to govern the data quality, to protect the information. So there's a series of steps. By the way, all of this information is on CDC's public website. So I think I'm going to, just in the interest of time, not go through every detail, but building the right foundation, working faster, focus on workforce issues, manage the partnerships, and then govern the change. Here's a look at a table that looks at activities at each of the main components of the system, but then breaks that out into short-term outcomes, intermediate outcomes, and the long-term objectives. The long-term objectives are obviously to strengthen the health, but there are intermediate steps, and we need to be aware of these as we sequence through the work that needs to be done in order to achieve the outcomes. The digital health strategy itself, this was a collaborative effort, collaborating both across the different disease programs within the agency and really across the donor community, the multilateral and other bilateral partners all participated actively, reviewed the strategy, gave us their comments, incorporated those in there. I'm going to pause a little bit on this slide because as we were going through, the 40-page, 50-page document, what are the essential points of the document? I think we've listed these here in, I hope, in a concise way. Digital enablement of the public health infrastructure includes these key areas. First, and probably most importantly, governance and leadership to ensure that digital enablement is owned and governed by the host country governments. That we move, second, that we move to a shared services architecture, that we use managed architecture, managed data infrastructure, and consolidated solutions, including cloud-based technologies. And I always pause to say this because I think for a lot of the world, they're afraid of cloud, or they confuse cloud with not providing the data ownership protections that are required. I think in today's cybersecurity threat world, the only way that we can actually assure protection is to do work in a professionally managed way, which I think means adoption of cloud, or at least movement towards cloud. So what are the policy barriers doing that? What are the conceptual barriers of that? What do we need to understand technically in order to understand that ownership is really about key management in today's cyber environment, and that if you don't have the proper management of it, you actually don't have control of your data because the cyber criminals actually have control of your data. So how do we make that shift? The third point is focused on analytics platforms that can be used to consolidate any kind of data, to bring it together, to catalog it, to make it more shareable and open, and to do the analysis and dissemination. As I mentioned earlier, data integration is an essential component of that. How do we bring that together in an automated way? How do we put security around that transfer of data so that only authorized people have access to the information? How do we define what's authorized under what circumstances? What is a process for authorization for research is different than a process for authorization for public health emergencies. How do we build enough authentication into the process so that only authorized people have access to the information? Then third is, how do we help people where they are so that they build digital solutions, make appropriate choices based on their context, and do so in an evidence-based way? And then finally, the workforce development, which I've talked about. So I'd say the digital health strategy is a strategic opportunity to accelerate the digital transformation of public health data workflow, including all the data sources. I think of data as a supply chain. In order to really take advantage of it, you have to understand it from beginning to end. Data sources need to be digitized, and automation needs to be labeled at the beginning. Typically, that's the clinical workflows. How do we move that through the local health authorities, the national authorities, regional authorities where appropriate, and sharing data globally where that's appropriate? How do we do that in a collaborative way? How do we show that the investment actually pays off for health? And then how do we share that information and those findings so that they can be broader benefit? I'm not going to go through this slide very quickly. It just talks a little bit about the process that we use to iteratively work through the strategy to make sure that all of our stakeholders have an opportunity. Brooke mentioned this in her opening. This is not new work. This is built on a lot of earlier work. Some of it is sitting at the table here at the multilateral and regional level, but also at the country level. More than 60 countries have digital health strategies. We were able to, I think, consolidate and reflect on those strategies. This is one way to think about what we're trying to achieve. At the bottom of the slide, you see the ability to kind of integrate data from the various sources at the country level. In essence, I think what we're trying to do is replicate that in as many countries as are interested in doing it, to do it in a standard way so that as that information becomes available, it can be shared both across and up to global and regional and sometimes programmatic bodies. There's a little bit of a different slice of what's in the strategy. On the columns, you think about what activities are needed at what level, what's needed at the global level, what's needed at the service delivery level, what is needed at the policy level, what is needed at the infrastructural level. And then the columns represent the different kinds of work. There's the digital tools, the workforce issues, the policy level issues. And hopefully this table talks about, shows some of the activities that are needed in each of those. Switching back to GPHDI for a moment, the work is focused on 7 core components. I've talked about these already, I think. I mentioned earlier, we are in year 2 of a 3-year project, and CDC, working with our country offices, has actually already begun to implement, to identify partners that we can work with to complete some of the work, and to start working with our country teams and partner governments. The dollar values and the number of countries give you a little bit of a flavor of, in the first year, what people really thought that they needed to focus on. Almost everyone is prioritizing governance and leadership. I think there's a collective understanding that that's a necessary component. Fewer places are looking at cloud infrastructure. Doesn't surprise me. I think we're going to plant the seed that this is necessary, but perhaps some of that effort will need to be longer term. the data analytics platforms, the integration and the automation and the workforce, clearly priorities for every one of the 10 countries where we are working. I should have put this slide earlier. We are deliberately trying to work as broadly as possible across 3 continents. It's a small number of countries in each of the continents, and a list of countries that is quite broad in its spectrum. Some are just getting started. Others have made a huge amount of investment in this space already and can act as leaders in this space. The remaining of the slide is just a little bit about the process that we're envisioning. First and foremost, how do we work collaboratively with other players in the space? Second, how can we fully take advantage of the $500 million investment that the US government has made in the domestic work? What are the artifacts from that we can pull together and reuse? What are the workforce training, the curriculum, the training components, the policy level documents that can be shared, the standards work, the implementation guides for messages? How can we leverage that so that we're not reinventing? And then at each of the 10 countries that we have identified, what does that engagement process look like? How do we make wise investment based on the current state of progress, identifying gaps where they exist, trying to target specific activities to fill those gaps? A little bit here on the contracting mechanisms that we've tried to put together to help us do this work. I think I'll skip that part. I'm actually going to just skip through the remainder of it because I want people to have an opportunity to comment. This, the DMI information is on the CDC website. The Global Digital Health Strategy will be on the CDC site. It's in process of working through the web design. It's already been cleared, and I can make copies available to anybody that's interested. Thank you, and look forward to your questions and questions from the panel.
Thank you. Wonderful. We're going to turn now to our other panelists to share with us their reflections on the strategy and, again, how this approach is already manifesting in their own work. And we're going to start with a very applied context in the East African community with Daniel Morenzi, who leads the ICT efforts for the EAC. And he'll speak for 5 to 10 minutes about what is happening in the EAC that's very reflective of the efforts that Zen just spoke about.
Yeah. Thank you. Moderator, will allow me to speak while I'm here because for me, I don't have a PowerPoint to make.
It's absolutely fine.
And he has really summarized it well, what we are doing with it, what we intend to do within our region. As she has mentioned, I'm the engineer Daniel Mrenzi. I head the ICT and the digitalization for the East African community. East African Community is an intergovernmental organization that brings together 7 partner states. And this is Burundi, Uganda, Rwanda, Kenya, Tanzania, South Sudan, and DRC. So in this context, I just wanted to thank the CDC for the wonderful digital strategy that they have come up with, which I think helps us as a region and also the global space that we are all operating in, since we saw that COVID, by the time it came, it wasn't seeing if you're either from Asia, Africa, Europe, or Middle East, or the rest. So it's the right time now for us to see the way we can do. And from the presentation and the question you have really asked us, the East African community, I would say that the strategy has come at the right time when we already have a treaty or a direction as the East African community that we had taken. Having said so, what have we done and put in place to make us really now move in the same direction with the digital strategy that the CDC has made? The 2018, we developed what we call the digital reach strategy for the East African community, and this is the 10-year strategy that gives us the way we are going to operate and tackle the health-related matters. And from the presentation, I liked the last slide where it was really explaining the governance structure. What have we done at the regional level, and not only in the area of the health. In fact, I would say that digital health is the one that is lagging behind compared to other automations and the innovations that are happening within our region and within, I think, the context of our integration agenda. On the governance side, the East African community approved our digital strategy, our digital reach, and this was approved at the higher level of the decision making. This is at the summit level by our heads of states. And I think we have to thank VitalWave to the big contribution you did. They really developed for us that strategy, and it was validated up to our heads of states. So what does this strategy going to help us in case at the regional level as the ESC, we really have done a big step that I would now wish to share with you, and in line with the digital strategy developed by CDC. Some few days ago, or maybe by the time we were hit by the COVID-19, it found us not, I would not say ready, but ready integrated. And I have seen some of the players here in the room here, whereby we have adopted at the regional level the interoperability layer of sharing our information. What does this mean? Out of all 7 countries, you will never have one common system that really works for all. But by the time we are really fighting the COVID and the region was totally in darkness, we all agreed to share the common data under the regional interoperability layer that we have shared. So I would say that the strategy has come at the right time now to give us a strategic direction in a way that we should not struggle to share data through other mechanisms, but now to have a platform as an enterprise architecture way for the region to be able to share the data. For us, we would see this strategy as not for the CDC, but I would say for the global, all the world, that regardless of where you are, because it's answering the movement of the people, it's answering the data sharing, the data quality side. So what have we done onto the cloud part again? The region has adopted the ESC cloud, and this ESC cloud is not only handling the health data. For your information, since 2016, the East African community, we have been sharing the customs data electronically from Port of Mombasa all the way to Bujumbura or to Dar es Salaam. That means that when someone is already moving his cargo, and we are able to track or share who is the person driving a truck, which truck is taking the cargo, being pharmaceutical, being the other goods and services, where have you stopped, who has given you the service, and which border have you exited from. So meaning that the strategy is coming now on the way to complement ongoing initiatives of the region, because we already have the protocol that allows us data sharing. So, but what we have been missing was the standards that are set that connects us to the rest of the world. And this is in the way that the East African community, we are, I think if I get it right, we are the only integrated region whereby you are able to monitor the cargo from the border, from Mombasa or Dar es Salaam. You know, we only have 2 ports that connects the rest of our 7 countries. So in this context, it's just a matter of time that the moderator gave us. We would even demonstrate technically how the cargo moves and the way the truck driver that moves that is able to share. So I would say that the strategy comes in the way that it's now going to drive us to be now connected to the rest of the globe. We faced the challenges during the COVID, whereby our airlines were unable to move. Moving to Europe, we were supposed to connect to EU DCC, but looking at what the strategy brings out clearly, it answers the gaps that the region has and the continent that has. So on the other side, what are we doing again? We know very well that countries are operating in their ways of the national sovereignty with their laws. At the national level, we have identified that there are several gaps of the data privacy and protection laws that limits the data sharing within our context. So the region has now adopted the regional data sharing policy and data protection law that now allows the data sharing. And the question that we have been always asked, that how come that we have managed to share the financial data, counterterrorism data, the money laundering data, the trade data, but we are unable to share the health data. So this, the gap that has always been, and I see some of the colleagues, we did a big job together in Rwanda, is to harmonize the donor coordination. The biggest challenge that we have, and I believe that it's being answered also by the development of the strategy here, is the donor coordination. The regional level now, we have come up with a donor coordination matrix, whereby if, allow me use USAID, who is next to me, when USAID is supporting a regional project, it comes to find us with a strategy. Now, our strategy of 5 years, if the donors from for the resource from USAID is able to support us A and B. So when MSH comes, we'll show them EF, because we have now developed accountability and an open information sharing for the donor matrix. And I believe this has been a major challenge that no one knew where are we heading from, where are we coming from, and where we are heading to. So I find that the strategy comes to complement in this, and also complements our national and our regional direction, whereby we pledge and request the donor understanding that this is the direction the region goes in. I remember some time back, 10 years ago, with my big brother, Randy Wilson, we faced a challenge in Rwanda where we are implementing the direction we are giving the donors. So you'd find that different donors want to contribute to one strategy or one direction. But when we stood our way and said, no, this is the way we are going, and our e-health strategy by then says this, and now this is the way you are helping us. So I find that we, at the regional level and the continental level, we are going to domesticate the strategy in a way that it gives also the donor direction that this is the way we are going to implement. Lastly, maybe I would say, and again at the regional level, to achieve this, we have set up other enabling environments. We have the centers of excellence, the regional centers of excellence that we have set. We have the e-health and informatics. It's a center of excellence, regional center of excellence, now set up, and we are building the big complex in Rwanda to support now the capacity building and knowledge sharing. So it's now in the line that once the strategy has come, the regional center of excellence for all our East African people will be now benefiting from the strategy, and will now take it as a curriculum also for the purpose of information sharing. We have set up also the regional center of excellence for the ICT. We know that much of the implementation and the development is done in the information communication. It's with Nelson Mandela in Tanzania. That's also a regional center of excellence, purely giving knowledge in a mobile technology. So this is something, again, we find that collaborating with the CDC and looking at the strategy like this, it finds us ready as the region in a way to give one direction to our way that we are implementing. Lastly, we are looking at the implementation of our registries now. We are coming up with the regional registries through our digital, ongoing regional digital strategy, whereby we intend to have the registries for classification of the maybe how the WHO classifies their medications and all the acts, the facility registries at the regional level. Why we are taking it at the regional level is to avoid the duplication of efforts, and now to come up in a harmonized manner that the CDC has already done. So in this context, the regional, we have positioned in ourselves to work as the 7 countries, and also into consideration that we are trading together with the rest of the continent and the rest of the world. Maybe our approach might look complex to the other of the institutions, but we found out that the moment we take it to the people-centered, the moment we are looking at that a person moving to where I am today, like in US here, in case I fall sick, what is the minimum information should I share? So that's the purpose of building our regional registries. And it's all anchored onto our protocol that was signed by all our heads of states. It's called the Common Market Protocol. That has 5 freedoms: the free movement of people, goods and services, free movement of capital, free movement of the capital. So in this context, the region has identified now one identifier as what identifies me as Daniel if I'm in Kenya, Uganda, Rwanda, Tanzania, and Burundi, and all of the rest. So we came up with a national identification, and in other systems, maybe it's easier for me because I oversee digitalization across the other sectors. In all other sectors of the trade, of the customs, of the opening up your account, you will never do any transaction within our country without using your national ID. So this is the same thing that we are advocating, that even in the health sector, so that we can achieve this strategy in a proper way with now applying the national identification. People may ask that, I'm looking at the time, maybe 1 minute more or less. But you may ask yourself that what happens to the newborn? The newborn, the laws now, the national laws that we are now harmonizing, every parent has to register their child within 15 days. And this was adopted within our regional immigration policy for the purpose of even controlling the child trafficking. So, and it helps us now. We are bringing the same policy for the immigration to now be used in the health services, so that now when you are giving the person the services, it's anchored on identification, which I found it's already being captured here. And maybe given time, I would explain more. And we find that the digital strategy that we developed, it's in line with the East African Community agenda, and it's in line with the integration agenda. And for your information, the almost 44 countries of Africa have ratified our CFTA, the Continental Free Trade Area. And this, what does it inform you, people on the other side of the world, is that the implementation of the free movement of people is going to be implemented within the region and the continent. So that's why we are now looking together as the region, that instead of seeing a person in Kenya alone, or Uganda alone, or Tanzania alone, we should see that system applicable. The minimum level is the regional level, because this is a person who will now need to move from Kenya to Uganda to Rwanda, because there is a free movement of people. So as maybe in his last slide we saw, implementation is happening at the Uganda only in our East African community. But me, I would advocate, maybe as I complete, that let's implement it at the regional level, so that a Ugandan who is moving from Uganda to Rwanda might first get the similar service, or to Kenya or to South Sudan, because there is a free movement of people. Thank you so much. And this is the status of our region in line with the digital agenda that we have discussed. Thank you.
Thank you so much, Daniel. We will continue down the line then with Merrick Schaefer, Senior Digital Health Advisor for USAID. Please take it away.
Thanks, Brooke. Hello, everyone. It's nice to see people in 3D rather than 2D, though I'm not used to seeing so many people at once. It's kind of freaking me out. But it's also interesting to see interoperability in action. I had the advantage of sitting next to Daniel while we were waiting for the panel to start, and he actually pulled up a random truck driver on a map that was crossing a border, clicked on it, grabbed the ID, and dropped it into the COVID database, and we could see their test status and all their tests and their vaccination status. and I was like, in real time, for real, right here, right now. And that was like pretty impressive to see what these architectures and these planned systems and approaches can actually bring for us. And as I transitioned, my own transition from doing implementation work to doing work that was more focused around policy and institutional change, I knew that the rate of change was going to be slower. Conceptually, I knew that. I don't think I quite realized how much slower things could be when you're trying to change the big shipping container a few inches so that you end up at a very different port at the end of the day. But I am excited to see the CDC colleagues join us in this sort of institutional reform agenda around trying to get our institutions to have coherent and well-articulated plans for how we're going to be working in this digital health space. Because it seems so evident at this point that so many of the challenges we're seeing are ourselves tripping over each other's projects. We have so many different tools, projects, approaches, standards, platforms coming up. All of those probably have a good reason to exist. And what we find is when you step back and look at the systems level, you've got a tangled mess you're trying to unwind. And if we're ever going to achieve the fifth priority of the GHPDI, of having that true international cooperation, we're going to need to be able to work together around common plans. And if we're going to be able to work together around common plans, we're going to have to be able to speak as institutions. And to be able to speak as institutions, we have to know what does our institution actually think or act or try to do around something. And I think that's ultimately what we're trying to do with these strategies. And you'll notice in the last few years, there have been quite a number from the digital health global strategy that WHO put out to ourselves, our own digital health vision, to the Global Fund's recent one, the CDC's recent one, Gavi's HIS strategy. The Gates Foundation is rewriting their digital strategy right now. The World Bank colleagues were just talking about how they're thinking about putting together a flagship paper to articulate their position and vision. And that is in complement to all of the national strategies that are coming out that are much more in-depth and articulate than they were a few years ago, that are focused more around an entire enterprise planning approach, that have costed elements to them, that have application architectures, data architectures, technology architectures tied together with those national strategies. And you see that with what Daniel was talking about, with what the EACs managed to accomplish. So with all of that coming together, it's really exciting because now then you get to go on the path of trying to actually take that strategy and make it happen. And so I'm eager to be able to work with you over the next few years to share the things we've tried, like trying to be better at measuring what we're actually spending on digital health in a more cohesive and planned way. So we can actually say, well, this is how much we're investing in CHW systems. This is how much we're investing in supply chain systems. To being able to get our actual missions in country, our offices in country, to have a common approach to do their landscaping before they invest in projects. They know what else is out there. And to be able to make sure that the donor coordination isn't just working at the global level, but is working at the country level and at the project and program level as well. So I'm excited about that, and hopefully we can trade notes on what works and what doesn't work as we work down our implementation of our strategies. Thank you.
Thank you, Merrick. We'll have our last panelist speak. And just to remind you all that we will have some audience Q&A coming up. So if you want to think about any questions you want to ask the panel as we're working through this, please don't be shy. So Garrett Mell of the World Health Organization, he is the unit head of digital health technology in the Digital Health and Innovation Department. Thank you, Garrett.
Great. Thank you so much. It's a pleasure to be here and on this panel as well. I think there's a real excitement from our side at WHO because of the consistency and complementarity of the CDC Global Digital Health Strategy and the data modernization initiative that's happening domestically with the Global Digital Health Strategy, and in a number of ways. The Global Digital Health Strategy, as my colleague Derek Munene mentioned this morning, includes these 4 different areas around joint learning and collaboration. The second objective really being around governance at all levels, the third being national policies, and the fourth being on person-centered health systems. Within the strategy, I want to note that there's a recommendation around the areas of the use of common services, joint and common architectural plans, and the use of terminologies, common registries, really reuse of and establishing the commons of digital health, and particularly a strong emphasis on the use of standards. This strategy very much reflects those principles and those objectives, and it is very welcome in the global digital health space, and we look forward to how these can amplify one another. I think as an organization, we very much emphasize the role of governments ensuring that they're driving and establishing their vision, their national policies, their investment plans, and their architectural visions. And the architectural vision is, it shouldn't be the last one, it actually should be the first alongside the policy. And I think we're starting to hear from Daniel and many other countries around the fruits of having a vision, adopting standards, ensuring there's a policy environment to help facilitate and ensure that systems that are being developed are done in a way that's coordinated and trusted. And that my organization, WHO, establishes guidance like the Digital Implementation Investment Guide that really helps ministries to ensure that the foundational mechanisms are in place. The foundational pieces like that are enabling, like governance and policies and strategies and infrastructure, the use of standards, and ensuring that the human resources are trained and have the capacity to help deliver digital health and ensure that they're getting the most out of that, including work like the planning the National Digital Health Systems curriculum that many of you may be familiar with. WHO is very much a partner to the GPHDI. I'm still getting a handle on that acronym, but that's the Global Public Health and Data Innovation approach. Thank you. And really around the recognition that surveillance and modernizing the infrastructure for surveillance and the use of interoperable standards is a critical feature to the success. We're focusing, within the surveillance area, we're very much focusing on ensuring that we deliver case reporting forms, IDSR, as well as other elements in the ecosystem using standards that help ensure consistency in data collection and execution of content. And we're very much using standards that we recommend being free and open source or open standards like ICD, LOINC, as well as the FHIR syntactic standard. I just want to note one of the ways that we have looked at the digitization of our normative content, which is really around ensuring that we are making available the common requirements that are needed in order for a government and their technology partners to build systems that are going to function as expected, as well as ensuring that the data and the computation that's needed is delivered as standards and interoperable standards. And so we're doing a lot of work with FHIR. I think Zen very much noted the data workflows and the ensuring that these are able to function end to end. And part of that is ensuring that there is a consistency to the use of data and the use of digital systems to ensure that they're able to exchange data across systems within a country, but also across countries. I think the successes that Daniel is seeing and that we have encountered with the COVID certificates for pandemic response are fundamentally about ensuring that there is consistency in data and representation, and also the trust that's needed between the different actors. So being able to verify where a certificate has come from which public health authority, so that those who are verifying can be trusting of the content that's there. We're very much focused on ensuring that the digitization process is systematic and is available to all, so that the content of data becomes the standard by which other systems can be built, and we can all collectively benefit from the data systems that are in place, knowing that they're in a consistent format. I just want to note that, with common standards, architectural patterns, content that's relevant to the domain and reflects on the minimum functionality within a technical system, that can be augmented and should be augmented by national and regional policies, and that can lead to trust at all levels. So we welcome this strategy. We recognize the value that it has to catalyze the visions that countries have in their digital transformation, and we very much welcome this. Thank you.
Thanks, Garrett. Wonderful. Thanks to all of you. I'd like to offer up, if people have questions, go ahead and raise your hand. We have people who will be sort of circulating the mics. I'm going to go ahead and ask a question that I have here for the panel, but if you want to ask a question of your own, just feel free to raise your hand, and the folks with the mics in the background will come over to you. Okay, so enterprise architecture. This approach, or the use of shared platforms, inherently requires near-term solutions for policy that can guide data sharing and protection, as well as address issues of governance models, other aspects of the enabling environment. So my question for the panel, and we'll have one or two people answer, and then we'll kind of move on to the next question, but how is your organization contributing to addressing these essential components of digital health?
I'll go for it. So USAID, we're doing it through a variety of ways. As you might have heard in the opening keynote, Tool mentioned, we have a bunch of guidance notes coming out that basically are meant for all of our staff around the world to help them understand how to implement our own strategy, which is in very close alignment with what the CDC is doing. And so that will articulate, there's an entire note on enterprise architecture itself, the third note in the series. The first one is on how to strengthen the enabling environment into the country. So I think on both of those fronts, we're going to have direct guidance to all of our countries around the world, which then will hopefully work with all of our partners on realizing that guidance. And then on the second thing we're doing is we're really focusing a lot on training. As Garrett mentioned, we've been teaming up with the WHO around the Planning National Systems course, which has this enterprise architecture, holistic national planning focus. And we had 426 people take it this fall alone. We've had about 600 graduates from the course overall. And this course's focus is on getting people to think about how to invest through, in conjunction with others, and design projects in conjunction with others that will fit together into a larger enterprise. And as ministries of health take the course, start to articulate better positions and lay out the plans like what Daniel's done for the region, that should then in turn lead to other actors like the donors, like the advisors, like the implementing partners to fit into those plans as well. So I think those are two areas that we are definitely leaning pretty aggressively into right now.
Thank you. Zen?
Yeah, thanks. I just, thank you, and I welcome opportunity to help implement some of those jointly in some of the countries. When I think about what it takes to actually share data effectively, I think it's about at least three things, and I think we've heard each of those talked about today. One is we have to have common understanding about what we're sharing, and that's the point of the standards. So can we get all of the content, all of the clinical content, laboratory content, to actually be stored in a format that's consistent so that we don't have to explain it or transform it or do a lot of data manipulation in order to share. The second is the policy level. Can we have a common understanding of what's appropriate to share at what time and with whom? So what content is needed in an emergency? What content is needed when you're treating a patient? What content is needed if you're trying to, build off of somebody else's research. Those are all different, and having those articulated in advance, I think, is actually useful. I don't know that they need to be different from one country to the next, so being able to work through the issues of implementing them in different contexts, I think, would be quite useful, and what are the lessons learned to do that. And then third is, what's the technical infrastructure needed to enable sharing? The trust framework. How do we set up structures so that once people have made a decision to share in an emergency, you actually know that you're sharing content, this set of content, with the person that is actually authorized to do that, and you have a trust framework that tells you who's authorized, and then you also know that that's actually that person, and it's not somebody else. What's the technical infrastructure needed to do that? So I hope we'll be able to work on all three of those as part of our implementation.
Thank you. Daniel?
Yeah, thank you so much. On the side of the ESC, we are looking at this today, building our regional enterprise architecture. And this regional enterprise architecture would really help us to now implement our digital strategy that we have put in place. We have been asked several times by our leaders. I think this is the only region where the heads of states can meet 4 or 5 times a year. And the question has always been that how come that other sectors can communicate, but the health cannot communicate across? And they already passed, by the way, even a directive to come up with the universal health access, whereby in case you are moving from Uganda to Kenya, your health insurance can treat you from wherever you are. But then the exercise we have at the regional level now, since we have the digital strategy, we have come up with an enterprise architecture where that we intend to roll out by the next year, and likely within our ministers of health and even the summit level, to allow us come up with a framework of the way the standards generally. The trust is already there, the policy is already there, but what we are missing has been the standard. We identified this while we are collecting some data on the maternal and child health, whereby you find one country, the denominator they use is different from another one. Even the period of, the frequency of reporting was totally different. So at the regional level, our major focus is not even the consensus, because the treaty allows us for information sharing, but the challenge we have is standardization, and now come up with the proper standards that in any way that we have. I was discussing with one of my friends, on our continent of the Africa that we have 54 countries, we have 419 HMISs, the Health Management Information System, and out of which they cannot communicate. But also when you go to the financial sector, you are allowed me to cross on the other side because it's my role too. When you go to the financial sector, you find that we almost have, plus microfinances and the rest and the fintechs, they are almost more than 1,000 plus or 2,000, but they are all communicating. So what we have achieved at the regional level, and I think at the global level, is that we accepted to have like the national switches that are built on a standard, which national switch allows you to transfer your money from America to now to Africa, to Asia, and to the rest. So the most focus that we are now changing to, so that we can achieve this, is the standardization and having the common standards that we implement, which is under our enterprise architecture. And that's the direction we took, because we found out that infrastructure, the other things can be bought within one day. But are you able to buy harmonization? Are you able, because that's a mindset issue most of the time that we are now driving. And that is the direction the East African community is taking, to implement the enterprise architecture at the regional level by applying the standardization and the harmonization of the tools we are using for the data collection. Thank you.
Thank you. Garrett?
I'll be very brief. I think enterprise architecture requires having a country or a region reflect on where they're at and where they're needing to go. one of the tools that we have, and I think is being widely used, is the Digital Health Atlas that helps a country to do an inventory on what tools they have and using what standards. The other area that I think is quite helpful here is, as Daniel's alluding to, there's value in having a recognition of which standards are appropriate for which use cases or which health domains within the ecosystem. And by defining that within the core content that we're releasing, that's consistent with WHO recommendations on the clinical public health and data side, in the smart guidelines format, we're helping to facilitate the development of systems that can interoperate and work within the enterprise. Thanks.
Thank you, Garrett. I think we have a question in the audience. And after that, I have one more question for the panel, and then we'll wrap up, just to foreshadow for you where we're going with the timing. Please go ahead.
Thank you for the presentations and the discussions. My name is CTNA from Kenya. Systems are as good as the people who use. So no matter how good a system is, if the capacity is missing, if the mind is not fixated to use the system, nothing much will come out. So I did not hear much about how you manage the change in human beings who are going to use the system. The second issue is to do with the standards that have been discussed quite widely. For systems to exchange data in a meaningful way, definitely standards must come into place. In Kenya, we have adopted the FHIR standard as the standard for interoperability for all health information systems. But we do not have the right expertise who understand the standard. So again, it boils back to the capacity. In addition to that, if you are going to exchange data, you must have terminologies which are accepted widely. Again, it's another problem that we are trying to overcome. We're developing now a national health data dictionary, but we don't have experts in terminologies. So I think, particularly where I come from, these areas must be addressed and addressed fully if we are going to reap the maximum from the technologies. Thank you.
Thank you. Would anyone like to address?
Yeah, I think I just wanted to respond to my brother there. Indeed, we realize that the regional level that we have a serious gap within the capacity building and the change management. So what is the region doing? Like we have done on the medicine side, I think people who are from the medicines regulation harmonization, we partnered with the WHO, Swiss Medic, and the CDC to come up with a regional compendium and a team that does the routine training and the capacity building on the way we do register the medicines, we do the counterfeit trace and track. So at the regional level, we are doing the regional collaboration to see the way we can bring in-house the resources. In fact, from the budget that was presented to the members of parliament, we received the grant from the GIZ, and those who are here, we thank them for that support to now come up with a training program, especially online, whereby we are able to train on the laboratory terminologies and the way we are doing it. But it's a regional take that we found that we cannot do it on a national level. And also in terms of the standards, as he has mentioned, we have already also adopted Smart on Fire as the easiest framework to use. But as he has mentioned, we have it as a challenge. So what we are doing today through our Institute of the East African Inter-University Council, because that is an institute of the ESC, we are now working with our different medical and training institutions within our region to come up with a curriculum for such a standards so that we can build a national and a regional capacity, not depending on to always imported expertise, whereby it's going to be still on high demand. So because of the regional setup, we have the Inter-University Council of the ESC, which brings together all our universities. And also we do have the Health Research Commission. Through what he has mentioned, it was done a research and we identified the gaps that we already have. So what we are doing at the regional level now, we are mobilizing resources, first of all, to ensure that we are now able to have a national sustainable team. Otherwise, the ad hoc part is working. We are now doing the partnership with the CDC, and those who are already maybe coming to Kigali workshop, you will see it. All our ministers of health are all invited for the Kigali workshop, whereby the region now is taking care to see that at least we have the buy-in and the change management. But we request the different donors and the players that are here to understand that the gaps we have at the regional level or even the continental level, it also involves the human resource. This is the new technology that the new ministers we have, the new PSAs, the DGs we have, they really don't have. And sustainability is built on the centers of excellence that we are putting up, which we request all of you to now visit the ESC and put the funds together. Maybe we can be a model for the Africa and the rest of the world. Thank you.
Thank you, Daniel. That leads me to the last question of the session. The point of enterprise architecture is to create shared digital infrastructure that goes beyond a single health program or even beyond a single sector. Yet many investments through the global health community are indeed specific to individual health programs. So the question is, how can development partners successfully support the creation of shared infrastructure when the reality of their investment structures lean towards specific health programs and individual sectors?
I mean, this is a struggle within CDC domestically. Historically, all of the investments in systems have basically gone to individual programs. They've recreated their solution from scratch. And it's a mindset change. It's inherently inefficient. I mean, in defense of people that have done that, I think the reason that they did that is probably because that was the only option that they thought they had. So as we modernize technology, we technologists have to demonstrate the value of a consolidated approach. And I actually think it is, technology has changed a lot. We have new tools available, low-code, no-code tools that we've been able to show, in limited settings. And some of our administrative work has been kind of like the guinea pig, that you really can reduce the development time by a third. So as we get better at standing up consolidated environments that can, ingest, catalog, analyze any kind of data, and then you no longer have to put programmatic funds separately into developing from ground up every time you have a data collection need. I think it will take a while for that to come to fruition, but I'm hoping that we can demonstrate that as part of this.
Thank you.
Yeah, maybe on the side of, again, our region, what we have decided, looking at the investment onto the infrastructure side is so complex, and each sector cannot do it alone. Our different partner states, through World Bank funding, we established what we call national data centers. So, and now within the regional and the national policy, we are now advocating to have the hosting of the data within the national infrastructure. The reason being that there is, you are assured of at least the support 24/7. You are assured of this training. This issue of the having your health crowd within the Ministry of Health data center, then the hospital, again, there are data centers. So this infrastructure side of the regional and national level, at the regional level, we did the concept, and now all our partner states have already the national data centers. So the only advocacy and we do is that when the program comes, we request the development partners to focus onto the national guidelines that are already established, so that the focus is done to support hosting that infrastructure within the national data center. Otherwise, you always face a challenge that we have always been doing. you find within your your area, you are supposed again to buy air condition, you buy UPS, you buy all of that as the technology comes up. And another technology again brings another hosting requirements. Today I'm running on the platform of maybe the Microsoft Windows platform, and another system comes is Linux, another on the Red Hat. So that cross part, we have handled it at the national level in a manner to have one shared data center. Then at the regional level, for the purpose of the now making the regional communicate with other regions, we are now coming up with our own cloud. So where I mentioned our central data for central banks are exchanged within our cloud. Our revenue systems are exchanged within our cloud. So we are expanding now the phase of the health cloud within another environment. So that as the investment comes on and the technology changes, we are only minimizing on the expenses of the other multiple different data centers and infrastructure and platforms that are being implemented. And this is the continental agenda again, because the African Union has benchmarked on their us, the ESC, and they are taking up this into the regional strategy for transformation, which I believe that it helps the development partners to now invest in a right direction and make the economies of scale. Thank you.
Thank you. Thanks to everyone. Oh, Garrett, please.
Yeah, just briefly, I think it's really important to note that in order for shared infrastructure in an enterprise architecture to function, we have to define the data standards and the representation of that. Without that, the interoperability within one health program to another health program is really, it requires integration points that are very difficult. So the kinds of investments that I think that you're asking questions about require the ministry to define what those standards are and to enforce that the investments that are coming in are building on top of a common expectation, so that when a new tool comes in, it doesn't have to integrate, it has to actually use that standard, and it, by default, will be able to function with that ecosystem. We can't continue to use monolithic vertical points as interoperability, and that's really the situation that we're encountering now. And without the government really leading that and defining what it is, defining that, and some of the standards that are now available, and this is why we're releasing our content in ICD codes and in FHIR and with LOINC, is because by providing those health domains and defining the specific health and data content, we expect that systems can build to that, and that they can then fit within the enterprise architecture. And that builds trust among different technology partners within the ministry to know that it will not only function as intended, but it will exchange data and operate within the ecosystem.
Thank you.
Thanks.
Well, with that, ladies and gentlemen, please join me in thanking our panel this afternoon. And congratulating again the CDC for the introduction of this new digital health strategy, which is so supportive of the entire digital health community. Thank you all for being here. We really appreciate it. Enjoy the rest of the forum. We will see you out and about. Thank you.